Good morning, everyone, and thank you for all being here, and to the media, thank you for continuing to get our message out. Let me just take my mask off. And I'm very thankful again to Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and Chief Medical Officer Dr. Robert Ruse, Mercy Trinity, for always taking the time to be here for these press conferences to update our public, our residents of the area, and the business community. So I'll give you a quick update, and again, we will do as we've done the last month or so or longer for Dr. Kerouac and Dr. Roos. They will come up right after me and take questions from the media so they can get back to the important duties they have to do at Bay State and Mercy. And then we'll go through all my cabinet heads on their updates pertaining to COVID-19 and other things that ancillary things pertaining to the city. So again, we've had a good trend, continues in the single digits for the weekend, but we have to stay ever vigilant. We want to continue to make sure we knock down a little uptick that is occurring in the state. Friday we had 5 new cases, Saturday 9 new cases, Sunday 7 new cases. Total overall cases from the beginning and back in March of COVID of 2,851. Unfortunately, we did have one more death. And again, from myself and my administration, from cabinet heads down to rank and file, our sympathy, thoughts, prayers, and encouragement to the families of lost loved ones. So that takes us to a total of 127 individuals have passed, city of Springfield residents pertaining to COVID-19 coronavirus. Of that, 56 are white, 29 are black, 40 are Hispanic, and 2 are Asian. These deaths occurred at long-term care facilities, 57, and at residential, 70. Our seniors, we continue to deliver meals to them. Vanpool has been very helpful in delivering their meals. Libraries, we have opened curbside, been very successful. Commissioner Helen, Kalten, Harris will speak of that. Updated me that we've served over 1,000 people pertaining to when we started, I believe in the middle of June. We're still awaiting our July numbers, so that's gone very, very well. We are continuing to reach out to our seniors. We've done a survey. You know, some are like to do Zoom, some are too accustomed or not want to do Zoom, so we're going to try to do a trial run hybrid on what instructors might want to do classes on Zoom, and what seniors might have some interest in that. But we're going to continue to do events. We're going to have a drive-through bingo. We're going to have a trunk party coming up, and hopefully we've made some more headway in this COVID-19 coronavirus, but we have a giving thanks parade, Thanksgiving time, and hopefully if we're not back into our centers. Some important things that Helen will, Commissioner Helen Kalten Harris will give more specifics, as will Dr. Mark Kerouac on testing. This is across the board, asymptomatic, and I'm very thankful this has stopped the spread. Governor Baker and I spoke to Lieutenant Governor Polito again last week or the week before, that we're very interested in having sites here, as Helen did with DPH, and Dr. Kerouac has been making a yeoman call on that for a number of months. So testing sites that are standing up will be standing up very shortly. Tapestry will be standing up testing sites by appointment. All this information will be on our city's website, and we'll get the information out 3 to 5 p.m., and that will start this coming Friday, August 7th. The 3 testing sites will be Kennedy Middle School parking lot, that's up in the Orchard, South End Middle School in our South End downtown area, and Zanetti Middle School. These are all in the parking lots. That's in the Ward 2 Hungry Hill in the North End area. Urgent Care AFC, this is up at 415 Cooley Street, which is the Allen and Cooley Plaza. People know that better that way. That is going to be done Monday through Friday. That's Quest Labs. The issue here is that Tapestry will be able to turn around tests between 24 and 48 hours, which is very good, as we try to get as quick as possible. Defeats the purpose. Quest Labs is doing this urgent care, and that's Monday through Friday, 11 to 7 by appointment. Saturdays and Sundays 10 to 4. But the key here is that you might have a 7 to 10 day wait, which really, on this testing stuff from the federal level, really needs to be some continuity of a quicker turnaround, because that sort of defeats the purpose. State Representative Carlos Gonzalez, I know specifically, has asked for testing down at the Edgewater Apartments, and Bay State Health is going to be accommodating on that. And I think Dr. Kerouac will speak of that. That's to be announced. The governor's travel ban restriction is in effect. Others of my staff will speak of that. And there's also a relook of group gatherings that Governor Baker has put across also, so that'll be re-examined. On the police front, Commissioner Clapprood indicates to me that 2 are out, COVID-related. Knock on wood, we had a good weekend, knock on wood. Commissioner Calvi indicates no one is out pertaining to COVID, which is very good. He is preparing, as is Commissioner Clapprood, as is Commissioner Helen Kalten Harris, as is Director Pat Sullivan, and Director Chris Signoli and others, on this remnants of the hurricane coming up the coast, whether it turns into tropical storms. They're doing all prep work right now. It looks like that storm is going to hit us sometime starting tomorrow, Tuesday afternoon around 2 p.m. Here's what we have to be cognizant of. 3 to 4 inches of rain. I know we desperately need the rain, but 3 or 4 inches of rain. Headwinds or winds up to 60 miles an hour. So that could be a potential issue. In turn, conferring with Pat Sullivan and Helen, if power is to go out, we will have areas, shelter areas in the appropriate neighborhoods if power goes out. Hopefully it does not go out for a prolonged period of time. DPW, there's no COVID. Again, Director Signoli continues to work. He'll be on with National Weather Service and FEMA. Bob Hassam, our Emergency Preparedness Director, he'll update all our cabinet heads pertaining to that, so they're preparing for this hurricane or tropical storm. Pat Sullivan continues to work very closely with Superintendent Dan Warwick and Helen Kalten Harris on our school reopening plans. Again, we're looking at 3 plans. And forestry is also ready to go if needed with the upcoming hurricane or tropical storm. Pat is also working on air filtration systems with our schools, and also bringing in an industrial hygienist who did a great job for us on our medical triage homeless tents, and all the buildings are being re-examined on that. Director Tim Sheen on Echo Dev, we're now moving to the CDBG Community Development Block Grant Program funding. That announcement will be coming out very shortly. Again, we've put out millions and millions of dollars to our businesses, whether small or mid-sized mom and pops, and a couple more $1 million to the residents to help pay mortgages, rents, and utilities, utilizing Wayfinders as a conduit. So we're going to continue to do whatever we can on the grants to keep our businesses and nonprofits afloat, and we're hopeful the feds in the state will continue to do their part. Superintendent Warwick indicates to me, we're over 2 million meals that have been served to our students and family members, and really the population, young population of families in the city of Springfield. About 86,000 went out just this weekend. We will continue, and that's breakfast, lunch, dinner, snacks. We are doing some specific sites that Superintendent Warwick will speak to you on, that we're doing other dinners too, to get out to our residents and families and students in need. Superintendent and his staff are working around the clock, 24/7 on the school reopening plans. He'll speak more of that. We have 3 plans being put across. DESE, Commissioner Riley, a lot of information came at the 11th hour, so we're working to the best of our ability, but I'm going to look you all straight in the eye. We are only going to do, as we've done throughout this continuous COVID-19 coronavirus, what is in the best interest of our residents, families, students, business community, going on the facts of public health, medicine, and science. So we have a town hall meeting, a Zoom town hall meeting, to get input and continue to hear from our parents. Superintendent Warwick, the surveying of the parents is going to continue. Thursday is another emergency school committee meeting where a possible vote might be taken, as we're looking to get as much information as possible, maybe even go after a waiver. Again, the 3 plans that are being put across, one is all in, which, unless something drastically changed, that's really would not be in the cards. 2 would be a hybrid, which superintendent will speak, that you'd be in and remote. And 3 would be a remote. And if it is remote, we have to be ready to transition to a hybrid at the appropriate time. Health comes first. We're balancing act on education is extremely important, and the desocialization that is occurring too. But we're going to do what is safe for everyone involved. Transportation plays a key issue here. I'm already we're already triple tiering our buses. So if we're at the bus service, and we're going to need, parents will have the opportunity either way when time comes, whether to send their children or not. But for instance, a full bus is 77 students. Under COVID-19, that cuts to 22, and we're already triple tiering our bus. SPED students, if say you have one of the larger SPED buses, 22, only 6 can go at one time. So this is a very, very complicated issue as we move forward our school system. On the finances, my CFO, TJ Plant, informs me overall a revenue loss about $5.7 million. Fiscal year FY21, which we're in, we're down about $800,000 now, and I've spent $6.1 million in deficit spending to make sure that the residents and the business community and the schools will be PPEs, we've all paid for those, and the kindergarten, the second grade, the laptops, because we want to be ready to go. But I'll go after every dime I get my hands on reimbursement from the federal and state level through FEMA, as we've done with other natural man-made disasters. And the last thing I'll say is Solicitor Ed Pakula, I appreciate his team. They're working very, very hard. That opioid case continues to move forward. And we've gone on it, our own, City of Springfield, in hoping when a decision comes that money, rightfully so, will come to the City of Springfield to do beneficial or proactive programs pertaining to public health and public safety aspects. So with that, I appreciate everybody taking the time to listen. And now, again, I'm very, very grateful that Dr. Kerouac, the President and CEO of Bay State Health Systems, takes the time to be here every Monday, as with Dr. Robert Roos of Mercy Trinity, Chief Medical Officer. They'll come up now, make their presentations. Subsequently, right after that, they will take questions from the media so they can head back to their important duties. Without further ado, the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Well, thank you, Mr. Mayor, and good morning, everybody. It's good to see you all here today. Mr. Mayor, I appreciate your leadership during this pandemic and giving us this forum, and also appreciate working with your team in containing this epidemic. We continue to see COVID cases at Bay State Medical Center with an uptick during these last 2 weeks. This morning we had 23 patients at Bay State Health. 22 of them were at Bay State Medical Center, 1 at Bay State Noble, and 2 were in critical care. The uptick is not related to the cluster that I mentioned to you a week or so ago, but rather is due to new cases coming in from the community. We continue our active efforts at testing. We're doing about 800 tests a day. That's a little down from our total max of 1,000, and it reflects the fact that supplies have been strained by demand elsewhere in the country. When we really have a need, we'll often send tests out to some of the commercial labs and to MIT, but that often does add a day to the turnaround time. So we're continuing to scramble to make sure we have enough testing supplies. We're very happy to give support to congregate living facilities such as skilled nursing homes, to other healthcare providers, and to the Edgewater community, as the mayor mentioned, and hope that we can continue to expand our capacity there. The 7-day average of positive tests has climbed in the last few weeks as well. It's gone from 1.7 to 2.2%. Those are tests done at Bay State. That's exactly the same rate of rise that has been seen statewide, 1.7 to 2.2%. It's of concern to us, and it's also of concern to the governor and his team, and it was largely what's been behind this campaign to mask up Massachusetts and to take a more serious look and a more aggressive enforcement at rules around large gatherings. Let me share with you a follow-up on the cluster that I reported on last week from a non-COVID unit. To be extra cautious, we tested patients at 0 and at 7 days after we detected the exposure. Remember, the window of exposure we were looking at was between July 15th and July 23rd. There have been a couple of late positives that have come from the original cohort. It's yielded an additional 8 new patient positives. That's for a total of 22 patients in this cohort. There have been no new patients detected who were not part of the original group. 7 of them are still in the hospital for non-COVID related conditions. The remainder have been discharged. Their follow-up testing of employees has shown the same thing. Initially negative testing, but follow-up testing at 7 days was positive. We've detected 7 new employees for a total of 33. So that's a total of 55 cases. Again, there were no new positives among the employees who were not part of that original group that we had thrown the net around. We believe, therefore, that the control procedures that we put in place on July the 23rd have arrested the spread of this cluster. We've been working closely with the Department of Public Health, who oversees our response within the hospital and is doing the community tracing, because obviously if a patient is found to be positive after being discharged home, they then need to have their own contacts checked out. We do continue, as I say, to see new virus cases from the community, but not related to this cluster. Bay State has done a number of things to contain the cluster. We've strengthened the enforcement of our existing rules, as well as the monitoring from day to day of staff, making sure that they're following appropriate masking, hand washing, and social distancing guidelines. We've designated new areas for employees to take breaks and to eat. We've implemented a new travel policy, which is more restrictive than the one now in the state. We are comfortable that we can care for patients safely based on the data we're seeing from this investigation, as well as the rules that we are now enforcing. It is difficult, it's tough to be a cautionary tale for others, but if we are, we pledge that we're going to be transparent in sharing information, and we're going to be aggressive at making improvements. Just a couple of notes about other COVID news for outside of Bay State. The Massachusetts vaccine made by the Moderna company has entered phase 3 trials with 30,000 volunteers. Giving the shot to monkeys produced an antibody which defeated the virus, which is a big deal, so that the virus being made, or the antibody being made by this vaccine seems to be protective. There have been a few cases of reinfection reported at the Holyoke Soldiers' Home. This is unusual, but it has been reported in other countries. There was a letter put forward by a group of scientists raising concerns about the aerosol spread of the virus. Aerosols are smaller particles that live for longer periods of time and travel farther different distances in the air than the droplets that we've been talking about. These were generated during experimental situations, however. It's important to remember that there have been a number of studies showing that the use of masks, as all of us are wearing today, does make a dramatic effect on reducing spread. And there's also been some conflicting data about the transmission of the virus as well as infection rates in young children. I'm raising all these things just to say that, you know, an average lay reader of the press is going to see loads and loads of scientific studies, and many times some very strong claims are made from those studies. I think it's important for us all to distinguish between what's possible and what's important on the spread of this virus. The people who decide what's important are the folks at the Department of Public Health and the CDC. They read all these studies. They weigh the strength of the evidence. They weigh the quality of the study, and they may or may not adjust their guidelines. And thus far, we have stayed with the same guidelines that we've been saying now like a broken record for several months, which is masking, social distancing, and hand washing. I continue to believe that if we follow these more rigorously than we have been in these last few weeks, we will get our arms around this epidemic and be able to get the trend of positive tests going down once again. So I would be looking less generally at the web and more at authoritative sites like mass.gov and coronavirus.gov. That's where I go to find out what's really happening and in terms of what studies are reliable and what the weight of the evidence is showing at any given time. So I'll stop there, and I guess I'll take questions after Dr. Roos's remarks.
Thank you, Dr. Gill. I also want to thank our sign language people for being here. Thank you very much for always being here. And Patrick Leonardo, Director of Operations for AMR Ambulance. They've been a great partner, especially dealing with when we had to make early moves on our vulnerable homeless population. Without further ado, Dr. Robert Roos, who's the Chief Medical Officer for Mercy Trinity, is here to bring his update coming from that facility. I deeply appreciate that he takes the time to be here. Dr. Robert Roos.
Good morning, everyone, and thank you, Mayor, and to all your commissioners for your continued leadership and work together. I also want to just give a thank you to our legislative delegation and specifically to Congressman Neal and his colleagues in the United States Congress who have continued to push and pass legislation to provide support amidst this unprecedented situation. The coronavirus pandemic has challenged us all. It has changed us. It's impacted us all in very, very significant ways. There's been an impact on our health, on our financial status, on our communities, on education, and without their support, we know that the toll would be much worse and the magnitude of that impact far greater. The reality is that the pandemic, of course, is far from over, and that the coronavirus is still very much present here in our community. And with travel and large gatherings, if individuals do not follow the public health practices that we've talked about time and time again of masking, physical distancing, and staying home or quarantining if sick, we know that this presents significant risk, not only to the individuals who can contract the virus and their health, but also to our hospitals and systems if we become overwhelmed with new cases, or to our community if the rates increase so much that we have to rethink the reopening. And so the focus this past week at Mercy has been on reinforcing and bolstering our approach to safe care for all, of which I'll describe a few changes in a moment. But I also want to thank and state that I am extremely proud of all of the colleagues at Mercy, our nurses, our physicians, providers, our therapists, our PCTs and ancillary staff throughout the entire organization, and particularly those at our inpatient rehab facility, formerly known as Weldon, over the course of the past week. As you know, this past week, Bay State had been conducting follow-up and contact tracing related to patients and colleagues who may have been exposed. And we appreciate that transparency. And we were informed that there were a few patients that had been discharged, that had possibly been exposed and sent to our inpatient rehab facility. And so subsequently, we at Mercy Medical Center had to engage in our own contact tracing and follow-up and assessments involving both occupational health, infection prevention, and epidemiology to assess and see what the risk was and then test patients and colleagues who may have had any exposure. And other than the patients that had ultimately tested positive from a prior exposure, I'm very pleased to report this morning, that no other patients or colleagues had tested positive at Mercy Medical Center. That includes tests that were performed yesterday, which is now 7 days after we first became aware. That result, I think, shows two important things. First, that there is an incubation period with this virus. It must be accounted for when we assess the validity of a negative test. In this situation, even a negative test upon admission did not necessarily identify cases who subsequently tested positive several days later. Had it not been for the collaboration and the partnership and the transparency, we may not have realized that there was a potential risk and patients needed to be retested. And secondly, this result in case also shows that the care safeguards, including the wearing of PPE and the universal precautions that have been put into place, do work. They will only work if they're followed universally, but they do work. So in order to support safe care, we've taken these learnings and we have created a new process at Mercy Medical Center to treat differently patients that are coming to our hospital from another care location. That includes patients coming from other hospitals or other congregate care settings like skilled nursing facilities or long-term care facilities or group homes. We have already been testing all patients upon admission, but now we will be treating those patients in a way as a person under investigation and continue to isolate them for up to 14 days, even if they test negative upon admission, and then repeat testing prior to discharge. This means they will stay in a private room. It means our colleagues will utilize the appropriate PPE and employ infection control practices as if they might be in that incubation period of the virus. We feel at this time it's better to be with more safeguards employed than not. Additionally, as we've recognized the risk of interstate travel that it poses to individuals, their families and loved ones, but also our community, we too have instituted a travel policy over the past week to align with the requirements that in Governor Baker's executive order. We are strongly discouraging any travel outside of the local community and the surrounding states, and mandating that colleagues will either quarantine for the full 14 days or have 2 negative tests, one within 72 hours of returning to the state, followed by at least a 3-day quarantine period and a subsequent second negative test, and only after occupational health evaluates their level of risk to return to work. We believe both of these changes will provide some more important safeguards to our community, as well as to the patients and colleagues. We're also making changes to our physical environment, the layout of our facility, to increase the amount of outdoor space for colleagues to take breaks or eat meals. reconfiguring the layout of some common areas, and providing visual management cues to help support people taking the appropriate distance or maintaining 6 feet or more during those times. I cannot stress it enough. This is not the time to relent, it's the time to reinforce. We've been providing safe care to you, and we will continue to do so. We do continue to have low numbers of hospitalized patients at present at Mercy. As of this morning, we are treating only 3 COVID-positive hospitalized patients, with 1 in the intensive care unit. We have had a positive test percentage rate over the last week of about 2%, which has increased by a couple of tenths of percentage points, mirroring the state's trends, with over 27,000 tests now performed. Yet, I remain concerned, as we all do, about the rising rates of infection, hospitalizations, and the percentage of positive tests here in the Commonwealth of Massachusetts. This is the first week in many months where we're seeing a week-over-week increase in all 3 of those areas, even if slight. The rates do remain lower than the thresholds that the World Health Organization has set for community reopenings, which is 5%. But the reality is, if we look at the data, we're no longer moving in the right direction. We have taken a slight uptick in the wrong way. We have been issuing caution about this for months. Unfortunately, we're beginning to see the increase that the data had predicted. As mentioned, we're also seeing reports of cases and of people who had previously recovered from COVID that are now susceptible and becoming infected and experiencing complications from an infection a second time. If this were to be true on a larger scale, and immunity is either not reliably produced or sustained, or that viral mutations are creating a slightly different coronavirus, it only means that we must remain ever more vigilant as we go forward. There does continue to be progress made on vaccines, both here in the US as well as in countries around the world, but it does not mean that this pandemic will be over anytime soon. This is a marathon, not a sprint. We will certainly be dealing with this in the winter and the fall and into the next year, and it's crucial that we support each other with all the changes that we've made and that we will continue to make to keep us safe and healthy. Wearing masks, practicing hand hygiene, limiting our travel, keeping our physical distance, and exercising caution with where we go and with whom we interact with are critical. The evidence is quite clear, and our experience is showing it to be true. Thank you for taking care of yourself and others. What we decide to do today will, in fact, make an impact on our health, our livelihoods, and our community going forward. Thank you.
Thank you very much. We'll turn it over now to Dr. Care Afc and Dr. Roos for questions from the press. I know Mike Mastrogelli's here from 22 Hall Tuthill, and others that are here, so we'll open it up to questions from the media, please.
What's your, on the testing, what's the turnaround time for your tests?
We have 3 different machines that do the testing. One has low capacity but can turn around to test in a couple of hours. We use those for highly suspected patients we're getting ready to admit. The workhorse machines that do the greatest volume are usually in the 8 to 10 hour range. And so basically, in-house testing will give a reliable result by the next day. When we send a test out, it often adds a day.
So these labs that are now returning tests in 7 to 10 day period, I mean, it's what's the point, right?
Right.
Yep, agreed. Yeah. Well said, Paul.
Yeah, well said. You could quote yourself on that one, Paul. Yeah, because you really need to move, because when you do this contact tracing, you've got to be there within a day or two, and quickly get your arms around it, or else people continue to spread and you lose control of it.
reinfection of, so one of the things you mentioned was reinfection. The incidence does seem to be fairly low, and there also is some evidence that it might just be somebody didn't completely get over the virus entirely. Since you both did mention the situation with soldiers who are not home,
Yeah, I think that one of the things that happens when a person gets a real active infection is that bits and pieces of the virus can still be detected by the DNA or RNA detection technology. It's not clear that those people are necessarily infectious to others. So that's option one for why a person might be, persistently positive. The other that's been hypothesized, and I think better documented in other countries, South Korea being one, that people who have very mild or asymptomatic infection may not develop much of an antibody response either, and may be susceptible to having the virus be reintroduced. Again, without getting into an immunology seminar here, there are sort of non-specific approaches that defeat viruses in general after first challenge that may be effective in getting rid of it, but may not give you lasting protection.
I will just
Interferon
concur with
versus
that.
neutralizing antibody is what
I concur with Dr. Kerouac's assessment. I don't have too much to add, but it is notable still to remind folks that this is a novel coronavirus. There is still much that we have to learn about it. One of the most interesting and concerning elements of this virus and its related infection is that it can manifest itself in so many different ways. Where with many viruses, it's a rather predictable response and infects certain organs in a way that creates a certain constellation of symptoms. This is unique in that it can create a wide variety of symptoms, ranging from completely asymptomatic in the majority of folks with infections to impacting some so severely that obviously it increases their risk and leads to significant mortality. And so there's still a lot we have to learn, and this may be one of those elements.
Mike Mastrivelli, 22 News, please.
kind of similar on this topic. So somebody recovers from the virus, most people do. What are some of these lingering health problems that we're learning more about people who have a routine?
Yeah, the virus causes a very brisk immune response in many people. So a lot of the folks who end up hospitalized may end up having inflammation and then subsequent scarring involving their lungs. One of the pitchers for the Red Sox is out with some inflammation related to the heart muscle. People have talked about the mental faculties or memory of people being affected. General fatigue as well. I remember some of the athletes saying that they just don't have the exercise tolerance they once did. So there can be lingering effects among a lot of people who've had to be in the hospital with this virus related to the fact that it causes a diffuse inflammatory response.
Any other questions, me? Matt?
Dr. Kerouac, earlier you said that in terms of the cluster that was at the hospital, first question of that is, are the number of people who are in the hospital for something else who have tested positive, are they reflected in the data that is reported to the state in the dashboard?
All of the patients positive related to the cluster would have been reported to the state.
So what I'm saying is that in the figure that you have hospitalized for COVID-19, we include people who might not technically be hospitalized for COVID-19, but are positive.
That's correct. Those, remember there were 7 patients who are still in the hospital for other reasons, but happen to have COVID. Those are part of that original group of 23 I mentioned to you.
So the 23 that you have right now.
Correct.
And in terms, is there any sense of whether there was any contact tracing that's found in terms of anybody who might have had contact with these 55 people, the numbers beyond that?
That is still ongoing with the Department of Public Health, and there may have been some secondary cases that we've detected, but we don't have any statistics on that for you right now.
And then this question again for both of you is, I know that a few weeks ago the federal reporting rules have changed somehow, and it's created some wonky stuff in how the state is reporting that information. How has that change affected both of your hospital systems, and is there anything we should be looking at when we see that data that we should keep in mind when we're trying to figure out exactly how many people are hospitalized?
When the federal government took data reporting away from the CDC and gave it to a contractor in a move that's been widely criticized. That contractor added lots of new data fields to report on, having less to do with individual patient counts and more having to do with hospital surge capacity. How many empty beds do you have? How many ventilators do you have? How many weeks of PPE, et cetera, et cetera. That has added to the administrative burden of reporting, and we have pushed back on it. I know the American Hospital Association has pushed back on it, but the way we report actual infected patients has been steady and gone through the Department of Public Health since the very beginning. And move on, if you want.
No, just add to the cumbersome nature of it has been challenging, but certainly we've been able to keep up with it.
So we should have, and both said this before, even though there's a relatively short turnaround time for, either one of you to be, getting your results, it's possible, for example, yesterday the report said there were 31 people in basic medical center alone who had COVID-19. Some of that is still just, there's a little space between when somebody might have been suspected as admitted and when the actual positive, or negative, I should say.
So the case, there were 23 this morning, and I think there were 20 yesterday. There may have been additional positive tests among outpatients that were reported back, but I've been giving you the inpatient numbers. We've not been much over 20 in several months now.
Maybe it was an administrative error.
Yeah, I think if you look at people under investigation, those are people who might come in with a cough that we're doing a COVID test on, we're putting them in isolation, and we're going to wait a day before we say if they are positive or negative. So, those should not be confused because those are not confirmed cases.
But if they're in the dashboard, they kind of fall in the same space.
No, they fall in a separate category. We don't.
Helen Kalten Harris has indicated that too. The state indicates about possibilities. We go on confirmed cases.
When the state has a number of other categories in addition to those that are tested positive, there are people who had a positive antibody test, people who had a doctor's diagnosis in the chart without a positive antibody test, and so there are a number of other categories in retrospect they look at and add to the numbers. We don't report on those.
Okay, maybe it was an administrator.
Yeah.
Any other questions of the media, please? Okay, to Dr. Kerouac, Dr. Roos, thank you so much
Thanks,
for
guys.
what you and your teams continue to do for us. Thank you. We'll now go to the public health with Commissioner Helen Kalten Harris, and as she said in the early morning cabinet head meeting today, and you heard from Dr. Kerouac and Dr. Roos, we are not out of the woods yet. Although we have made substantial gains, we have to be ever vigilant. A commissioner will speak to you on that this is going to be around for a while. We're going to go into the fall, we're going to go into the winter, and we're going to go into 2021. And I hope we're wrong, but we can't let our guard down. So the mask wearing, all the other public health moves we're making need to be followed and adhered to. Without further ado, the Springfield Public Health and Human Services Commissioner Helen Kalten Harris.
Good morning. Good morning. And once again, Mayor, as always, thank you. I appreciate so much your support. In our update, the confirmed cases in the Commonwealth of Massachusetts are 110,430. Those probable cases are 8,028. And that represents a 7.27% of all cases. I think that's important because while we don't count those probable cases, they do represent about 7.5% of what the state is reporting. The probable deaths are 221, which is 2.62% of all deaths in the Commonwealth of Massachusetts. We are 8,417 deaths on the statewide level. Hampden County is 698 of those, which is 8.29% of the Commonwealth. Springfield, as the mayor said, is 127. We are 18.19% of Hampden County and 1.50% of the state. The mayor did the breakdown of those individuals in our community who represent each category: 56 white, 40 Hispanic, 29 Black, and 2 Asian. 70, as the mayor said, are residential, and 57 are from long-term care facilities. For the week of July 27th, Monday, there were 8 cases in our city. Tuesday, 3 cases in our city. 4 cases on Wednesday, Thursday, 11, and Friday, 5, Saturday, 9, and Sunday, 7. I am so amazingly proud of the residents of the city of Springfield. Those numbers tell you that you understand that this is very serious and you are doing what's necessary to stem the tide of this deadly virus. Thank you. And I do hope that we will continue to work together to do those things that we know must happen in order to continue those numbers. This map to my left represents 1,694 different locations since we started keeping data where the virus is in the city of Springfield, or has been. That's important because we understand that there is potentially still community spread. We ask you once again to be vigilant, to understand the importance of adhering to the guidance, the hand hygiene, the social distancing, and most of all, wearing of face covers. The wearing of face covers or masks has become a political statement. Many individuals see this as something that they should not do based on the advice they may have been given. Trust me when everyone in the scientific and public health community tells you face coverings are critical to stemming the tide of this virus. There should be in our nation a national testing strategy. It is terrible that we stand here as one of the wealthiest nations in the world and we have to wait 7 to 10 days to get testing results. It is unconscionable, and we should be ashamed of ourselves as a country when we get to a point that we cannot take care of each other in the way that we need to based on our lack of supply. You heard Dr. Kerouac say that Bay State is having difficulty with their supply chain. This should not be happening in the United States of America. When countries around us are doing an amazing job of suppressing this virus, here we are, watching people die every day. Almost 1,000 people in our nation die every day from coronavirus. And it could be prevented if we had a national testing strategy and we had a national advice from the federal government that masks are a mandate. The Springfield Department of Health and Human Services over the last week has been working with 3 entities to stand up testing for Stop the Spread. The Commonwealth of Massachusetts State Department of Public Health chose these 3 entities based on their ability to work with us. They are AFC, Urgent Care, they are Tapestry Health, and they are Bay State. AFC, Urgent Care, whose link will be on our website shortly. As you heard, the challenge with that, they are Monday to Friday, 11 to 7, Saturday and Sunday, 10 to 4. However, the turnaround time for those test results, they are using Quest Lab is 7 to 10 days. We're hopeful that it will speed up or that there'll be an intervention where the time will be shortened. But that's what we're dealing with, and that, to me, we should say shame on ourselves as a nation when we've gotten to the point that one of our major labs, Quest is a major lab in the Commonwealth of Massachusetts, cannot turn tests around faster than 7 to 10 days. Again, Tapestry will begin on Friday. Their turnaround time is less. We have chosen 3 places for Tapestry to begin their testing. However, again, they are only going to be able to do 24 at one time. That is not even a drop in the bucket for the city of Springfield, but we're grateful that they are going to work with us. Again, that testing supply chain, the United States of America lags so woefully behind many nations across the world. On August 1st, travel restrictions went into effect. Visitors from outside of New England, those individuals from New Jersey, New York, and Hawaii, other than that, the governor is asking individuals coming from other parts of the country to do a 14-day quarantine or have a negative test. Massachusetts residents traveling to other places will also be required to quarantine for 14 days or show a negative test, unless they're traveling from one of the places I just mentioned, the New England states, New York, New Jersey, and Hawaii. That travel does include colleges as well. So we understand the importance. There is a form that the governor is asking individuals to fill out. There's also a $500 a day fine for entities or individuals who do not comply with the travel order. Indoor gatherings, the hotline at my department lights up with individuals and groups who are getting together that are unauthorized or are not using the prevention measures. Indoor gatherings is 25. Outdoor gathering is 100, and that includes anybody on site. We do not want to go backwards, and we've had clusters or individuals report to us that there have been clusters of individuals who are as much as 100 indoors. That's a super spreader event. Be clear. When you get an individuals in a place that are more than 25, that cannot socially distance and are not wearing face coverings, that is a potential super spreader. I also want to point out that there are individuals who have called me and said, when they're in line places and they're seeing individuals who don't have on face coverings, they ask them to put on a face covering, or they'll ask the store not to serve them. They are harassed. Many people are being told to mind their business, and people understand, if I am an elderly person and I'm in line and I'm waiting to get some product that I need, and then you don't have on a face covering, my health is at risk, even though my mask protects you, your mask protects me. Protect me, please. Wear a face covering. We are working with colleges to assure there is a communication strategy between the colleges and our department. The colleges will probably do their own contact tracing, but those positive cases will come through the Board of Health for the city of Springfield. That could mean that our cases could potentially rise, and so we're working closely with the colleges so that we are having a document that is standard operating procedures throughout the city of Springfield. The libraries, as you heard, are continuing to do well, serving the curbside. The Department of Elder Affairs is really out there trying to do their best. They did do a survey around those interested in Zoom, and 44.83% were interested, and then 55.17% were not interested. Now, much of that is based on the inability to have internet, perhaps, or to be comfortable with Zoom. So we are still continuing to work to stand up some Zoom programs. On August 27th, there'll be the parade, the Scoop Parade. There'll be a drive-through bingo, a tailgate party, trunk or treat, and perhaps a caring thanks parade in November. I want to thank Sandy Federico and the staff at the Department of Elder Affairs, doing an amazing job in very difficult times, so I thank them very much. Thank you to AFC, thank you to Tapestry, thank you to Bay State Health, thank you to the Springfield Department of Health and Human Services staff, who are also doing an amazing job right now, every day. Thank you to AMR. Our partnership with them, Patrick Leonardo just told me, has been approved by the state, and so we will be working together this fall to do flu shots. And so I'm very pleased about that. We will work out the logistics. We have not done that, but the Commonwealth did approve our plan. And so finally, my quote for today from Helen Kalten Harris says, COVID-19 public health influences economic wealth. That is important because unless we get this virus under control, unless we do what's necessary, then our economic wealth is going to continue to suffer. You can't have economic wealth during this time without good public health. So I implore everyone to continue to do the good work that you're doing in the city of Springfield. Again, I am so proud to be the health commissioner of the city of Springfield. City residents are amazing, patient, and attempting to do what's necessary to keep us all healthy, and I am appreciative. Thank you.
Thanks, Helen. That's the elegant and eloquent Commissioner of Health and Human Services. We're proud to have you as our Health and Human Services Commissioner. And let me echo what Helen indicated. It's shameful. It is shameful that we are still struggling to turn around testing processes in the United States of America. And on the federal level, from the president on down, there has to be I'm going to use an old basketball term here. John Wooden, the legendary UCLA championship coach, used to have this red zone full court press that would just suffocate a team. Well, that's what we need on the federal level. We need a full court press on this. I think Paul Tuthill alluded to. What the hell difference, what good does it do if you're going to get a test turnaround in 7 to 10 days? You need a test turnaround like that. So you can isolate, you can contact trace, and then you can mitigate. And Helen's other point too. We're all about balancing, Tim Sheehan, Director Sheehan, economic development and businesses. But if the consumer confidence is not there, and we don't continue making strides with public health, it's out the window. So enough of the charade that's occurring on the federal level at times here. We really have to get a full court press on this testing across the nation. You see other states that were being said, oh, they're really not affected at all. They're being affected now. So if you want to get this economy going, you want to get the United States moving forward, let's defeat, which we will, this COVID-19 coronavirus, and then we'll get back roaring. Enough of this, saying this, not doing this, saying that, and doing something else. It's very frustrating. We get these testing sites up, worked hard with DPH and Helen, Lieutenant Governor Polito, Governor Baker, getting them up. 24 at a time. Give me a break. You know, we're appreciative of it. 7 to 10 day turnaround. And we're doing well here in Massachusetts and New England and Springfield. So this has not, has not been taken seriously on the federal level. That we are still lacking in supplies, PPEs, testing, turnaround time. You know, with all due respect, maybe they should take some cues from what we're doing here in Massachusetts or in the city of Springfield. So thank you, Helen, for mentioning that, because this is wearing on all of us and our families and our workers. And as Helen indicated early this morning, this is not going away. We're going to go into the fall, we're going to go into the winter, we're going to go into 2021. So we got to keep our pedal to the metal. We're going to go into the public safety portion of the press conference, and I will bring up the Commissioner of the Springfield Fire Department, Bernard B.J. Calvi, for his update. Commissioner Calvi?
Good morning, Mayor. Good morning, everybody. Thank you. At the Springfield Fire Department, we currently have no one out with COVID or COVID-related symptoms. We've continued to be busy with answering our usual day-to-day calls. We've had several structure fires over the past several weeks. We've made one arson arrest, and we are looking for another suspect in another arson case from a fire off of Sumner Avenue the other day. With all that being said, we're now preparing for the upcoming tropical storm hurricane, which is coming up the coast. We're making all preparations to make sure everyone's safe. Over the next couple of days, I urge people to use great caution around running water around the small streams and brooks in the city. As the rain comes in, those little bodies of water could be storm flooded and flood swollen, so you could be swept away very easily and into a drainage and washed downstream. So everybody, please be careful, look out for each other as that's going on, and that's all I have for today. Thank you very much.
Thanks, Commissioner. On the police front, I had the opportunity, simulation of what our brave and dedicated men and women in blue do day in and day out to save lives and to go home to their families. And the split-second decisions that they have to make under emotional adrenaline going on is unbelievable, And I think it would open the eyes of many in the community across the nation about what they have to deal with and when to use complete force or different versions of force. It was very, very eye-opening what they do, and their head, heart, and gut is out there to save lives and get home to their families. So I appreciate what Commissioner Clapprood and the brave and dedicated men and women in blue are doing day in and day out. She will give you an update. Without further ado, the Police Commissioner of the City of Springfield, Cheryl Clapprood.
Thank you, Mayor. Good morning. As mentioned, we have 2 out now because of COVID. One is a positive test, and one officer is awaiting his test, hopefully not with Quest Labs, but that might be a while. But he's awaiting his test. Other than that, it was a decent weekend. The women and men of the police department served us well, and we are putting on some extra patrols starting tomorrow during the day through Wednesday to help out with if I have trees or wires down to keep the people safe. I urge you not to drive over or get out of your vehicle. If there are any wires down, let us take care of that. We'll call the proper people. And be careful, as the Commissioner mentioned, we have some areas that are very prone to flash flooding. So, you know, if you see the water, please don't drive through it, drive around it. But we will have some extra patrols out doing those details. Thank you.
Thank you, Commissioner. Another hot topic going on in the city is getting our children back into schools. And before I bring up Superintendent Warwick, again, Helen, I got to echo the importance of wearing masks. I will get these form letters coming from local or across the country on the argument of why masks should not be worn. Tell that to a family member. Tell that to someone who has lost the battle. Tell that to someone who's on a ventilator right now. And these dissertations that are sent to me boggles my mind, when it's just simple as doing this, staying away, following the guidelines. The rationale is just, with all due respect, it's just unbelievable. With that, let me bring up Superintendent Dan Warwick. He and his team have been doing yeoman work, working around the clock on what is the most safe possible way. We will continue education no matter what, but how we move forward on all-in, hybrid transition with remote. Superintendent Dan Warwick.
Thank you, Mayor. As the Mayor said earlier, on the meals front, since schools have closed in March, mid-March, when we had to close schools down, we've now served 2,002,686 meals to families from our 17 sites, and we use Central as well on Fridays. We also expanded dinner and evening services at some of our schools to see if it would make it available to more families. Just this weekend, we served 83,654 meals across the city to families. So the work of my team and the Sodexo team has been positively incredible. Summer school has been ongoing. We're going to finish this week on August 6th. We actually expanded summer school this year because of the perception of learning loss in the spring where kids were out for a while. We thought extra opportunities. So we put the money in the budget. We expanded summer school to serve more students and make it available not only to students who had to make up a course or because they were performing at a certain level, but to everyone who wanted to participate during the summer. And some of our local businesses came in and offered prizes to students in a raffle for participation. So we're very grateful for that. The summer's been made up of planning the 3 models for potential school opening that we talked about and were put forward by the commissioner, whether we come back in a full opening, full reopening, a hybrid, or a remote. And those are our possibilities that are still being considered. Our job was to plan for all 3 possible eventualities because we could operate in several different modes during the next school year and have to pivot from one to the other. So that's what my staff has been preparing. That decision is going to go in front of the school committee. I know the school committee is having some hearings on it. Tuesday night there's a town hall. They're going to consider some possibilities on Thursday, and we'll see how it goes from there. You know, when we looked at full reopening in Springfield, and we did a complete parametric analysis with Canon Design on all of our buildings, it was very, very clear that in Springfield, based on our population, we haven't had that loss of population account in other districts have experienced, that we cannot bring in everyone back and keep everyone at a 6-foot distance. It's just impossible. So the only way we could do it is either a hybrid or a remote safely. We worked really hard in the spring. We had participation rates with remote that were much better than many experienced throughout the state. Working very hard on that, and I just want to recognize the school committee 5 years ago, and our mayor supported us when we brought forward a proposal to go with one-to-one laptops for our students. And in doing so back then and in providing a lot of professional development, we were able to implement that plan much better than many other districts. During the summer, we had one-to-one laptops for students in grades 3 to 12. The mayor helped us, and again, not coming out of the school budget, but making sure we purchased for K2 students 1 laptop for every student. We had 1 for every other student. So that purchase has been made to even make the remote possibilities more effective. Another thing the mayor did for us, because our budget has been, still don't have a firm budget, is he stepped forward with city funding so we don't have to take it out of our school budget, and purchased over $3 million worth of PPE for our staff and students. So I just want to thank the mayor, who's always been there for us, and the rest of the departments in the city. Done a lot of work with the health department. Helen and her team have been involved with us every week since school's been closed, helping us, working with us to make things as safe as possible for our population. And our facilities department from the city, Patrick Sullivan, his team, John Carrigan, and Patrick Roach in my department have been working on getting the facilities ready. Since we know this is an airborne illness, we're taking a look at the air quality in our buildings and taking a look at everything we can do to get those facilities ready so that when students and staff come back, it's as safe as possible. Including hiring an industrial hygienist to take a look at our buildings with us and do a complete analysis and certify that those buildings are indeed going to be safe for our staff and students. So it's been a very, very busy summer, very, very hectic. I think there's a lot of nervousness in the community. Helen and I were talking about that today, and you can understand that. People are facing a decision where they're going to have to either make a decision to send their kids back, should we open in a hybrid model, or keep them home in a remote model. And we know those are tough decisions. In a hybrid model, we feel we can offer better educationally because we'll have the students in front of us part of the time and just do the remote at other times. In the remote, we'll do the best we can, but that mode isn't as effective as when you have a teacher directly in front of students. But we're working in either eventuality to implement those as effectively as we possibly can. The one thing that I will say to calm everyone down is, for any parent who's nervous, it's going to be their choice. Should we open in a hybrid model, every parent has the right to choose remote only if they're nervous about sending their child in, or their child has a pre-existing condition. And should they make that choice, we're going to service them fully remotely. So for every parent, that choice is going to exist. We talked to parents in the spring. We did a survey. We're going to do another survey now. We're going to hire some teachers to actually call every family and explain the options to them and see what they'd prefer. But assure them that they make that decision for safety for their child. We're still going to serve them remotely. So I hope that relieves some of the anxiety out there. But I think anytime you have a situation like this and you see a lot of national press debating the issue one way or the other, I think it raises the anxiety level with parents and with community members. So again, I want to thank my staff and the other city departments that have really been working alongside us all summer. It's been a very difficult summer because most of the DESE guidance, the transportation guidance, came out just within the last 2 weeks. The facility guidance, same thing. Most of the guidance has been very, very late. So from DESE making the decisions all the more difficult. But we're working with that time frame. We're going to have a discussion Thursday night with school committee. We're going to have a town hall to, more importantly, listen to parents and community members, and then try to make the best decision we can, taking into account the education and the health and safety of our students and our staff. Thank you. Thank you, ma'am.
Thank you, Superintendent Warwick. And again, that town hall meeting is tomorrow, Tuesday. I want to thank School Committee Woman Latonia Naylor, who really wanted to pursue this, and Vice Chair Chris Collins. We wanted to put this together, but her initiative to let's get it done as quick as possible. And I also want to thank, we're going to have Commissioner Helen Kalten Harris will be with me on that Zoom meeting, as will Director Pat Sullivan, Facilities and Parks Facilities. So that's on physical plant and on public health, to try to make sure that we hear all the concerns coming from parents, families, students, staff, and teachers. As Superintendent Warwick alluded to, continuing on the meals program, we're continuing on the Oasis Food Bank. That's about 3,500 people, and thank you, Danny, at Central High School, and Principal Tad Tokar Sedesco, John Foley, the Food Bank of Western Massachusetts. We are still feeding every Friday about 3,500 families with everything from meats to milk, the vegetables and fruits, to make sure that we continue to do that. So let me segue now into with parks and facilities. The director, Patrick Sullivan, he and his team have done a great job, yeoman work. Director of Facilities Management and Park Superintendent, Patrick Sullivan.
Thank you, Mayor. We continue to monitor all building activities, and to date, all operations are being implemented as planned, and we appreciate the residents taking the time to make those appointments before coming to City Hall or to Tapley Street. We also appreciate the community organizations wanting to host events and their cooperation in preparing COVID plans. Myself and Commissioner Helen, Human Services, had 2 Zoom phone calls last week that were very productive. And it's reassuring to both us and the mayor that people that want to host these events understand the importance of the COVID-19 and what they need to do. So I think we're going to have some positive information to report out at the end of the week. As the mayor and the superintendent of schools stated, we are working with them on the reopening plans. We are contacting with Bob Kirchner, industrial hygienist from O'Reilly, Talbot, and Oaken, to review the school opening plans. And I want to also stress, he worked with both Helen and I and the mayor on the Friends of the Homeless and Tim Sheehan, and that was very successful. I think at one time, Helen had over 18 positives, and that kept the spread from going through the Friends of the Homeless. So we will take that same tactic with all of our buildings as we move forward. And then last, with the storm predicted for starting tomorrow afternoon, our forestry division and our contractor Northern Tree is going to be ready to respond to any trees or power outages. We will work closely with our DPW and Eversource should that happen. Also, if there is any long-term, be reassured Helen and I will open up any buildings necessary to keep residents comfortable. Also, with the high winds, they're saying 45 miles and gusts up to 60, so prepare your yards. Everyone has their lawn furniture out at this time of the year. So if you could take that time to just stack them and make sure to prevent any flying debris. And we're going to be going through our parks, cleaning catch basins today and tomorrow. And if you could do the same thing, I know that helps Chris and I to get out to these storms. If you can clear your storm drain in front of your house. Thank you.
Thanks, Pat. Thank you, Director Sullivan. And we'll segue into DPW. Chris Signoli, the Director of Department of Public Works. Again, his crews are out there day in and day out. Trash, recycling, bulk, yard waste continues to be picked up. Now they're preparing for this hurricane tropical storm as it roars up the northeast on that. So without further ado, Department of Public Works Director Chris Signoli.
Thank you, Mayor. With regard to COVID, the DPW is operating at normal strength. We are also preparing for this week's tropical storm. Within the last 15 minutes, it has been, our warnings have been, it has been upgraded to a tropical storm warning. With the, as Commissioner Calvi and Commissioner Clapperud mentioned, with it being so dry, the rain that we're going to get for this is going to run off very quickly. The ground is actually too dry. Some water is going to run off. So in your basements, I think if you have, prepare your homes to make sure you don't get water in your basement. I think it's going to be very, very difficult to find contractors who will come and pump out a basement. And I think the fire department is going to be a little preoccupied to be able to go out there and do it. So please make all your preparations today. And as Pat mentioned, check out in front of your home your catch basins. The city has over 30,000 of them. So making sure that water can get into all the basins and away from everybody's homes would be very helpful. A National Weather Service has a briefing this afternoon, which the DPW will post information on our website if there are any major changes to that. later today, and it will also be posted on the city's website as well as both of our Facebook pages. Thank you.
Thank you, Director Signoli. Again, City of Springfield's in the business of being in business, and Chief Development Officer Tim Sheehan is here, and I appreciate his efforts and his team's efforts. We've literally poured in millions and millions of dollars of grants to businesses and our residents to keep them stabilized and moving forward. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. This week we're finishing up the contracting for the small business grants. I just signed approximately 20 of them to move out. We have contacted all of the nonprofit award recipients. We will be advancing contracting with them through this week. And as the mayor indicated, staff has turned its attention now to the normal CDBG program. We have reached out to all of the applicants for that program to determine what is the impact of COVID on their programming. And we expect to advance awards for programming that can take place and advance in this environment, hopefully by the end of this week. Thank you.
Thank you, Tim. Thank you, Director Sheen. I think Solicitor Pakula and HR and Labor Director Mahoney are all set with their briefings early this morning. So, gentlemen, I think you guys are all set? Yeah. So I'm going to open it up to the media for any questions or comments pertaining to my cabinet heads or myself. Yes, ma'am. Sure. Paul? Yeah. Helen?
The testing sites at Tapestry is going to stand up on Friday as part of the Stop the Spread program. You mentioned that there's a limit on the number of tests that they're going to be doing. Can you explain that again?
Yes, they are going to be there for 3 hours. They said that they can do 2 tests every 15 minutes. That equals 24.
So that's 24 at each site?
That's correct.
How long do they anticipate they're going to operate? You said will they be daily after Friday?
So Friday, we have 3 days next week. I'm sorry. So Friday, we will be the first site. There will be 2 other sites the following week. So that in total, there will be 3 sites that will be stood up, each doing 24.
And those will continue, those 3 sites will be open daily then?
No, the 3 sites will be fixed days and times for the sites. So on Friday, we know that it'll be from 3 to 5, that site. Next week, we have 2 days where we will have 2 more sites, which will probably be from 3 to 5 with the same capacity.
Okay, and that will then continue in a similar schedule then?
The challenge that we have is the Stop the Spread initiative ends on August the 14th. And so we are trying to get as much in as we possibly can in the next 2 weeks. And that's why AFC Urgent Care site is one that we definitely needed to consider, because even though the turnaround time is long, it's our goal to try and get as many people as want to tested during this time. Remember, it is for asymptomatics, it's for anyone who can come, and the test is free because the Commonwealth is supporting these organizations. Again, these organizations were given to us from the State Department of Public Health. These are not entities that we went out and chose, but were chosen for us to work with to try to stand up sites.
And so, again, you said that for asymptomatic individuals, do they need to make an appointment or go to a doctor or anything like that when they be tested?
They do not need a doctor's order. Yes, they need to make an appointment. Our website will have the links on them to the appointments, and their particular websites, AFC Urgent Care and Tapestry, will also have links on their website. I should say, while we understand that Bay State is going to do Thursday at Edgewater, we will be in communication with them that for that following week to hopefully get more test sites from them. But I don't have that information right now. I have been on conference calls with the top leadership at Bay State for testing, and again, they recognize that there is a supply chain issue that they are dealing with, and certainly they did not expect to be dealing with the internal cluster that popped up.
So Friday, Tapestry site will be where?
Tapestry site, I'm going to, the mayor and Tapestry will send out a press release within the next hour to two with which site will go first, second, and third. I need to just simply make sure that we are all on the same page about our strategy, but that will be announced within the next hour or two. Maybe give me 3, 4, but anyway, somewhere in there, we will be announcing that.
And that'll all be on the city website?
That would be correct.
Thank you.
You're welcome.
Any other questions? I know Sarah Granelli's here from Western Mass News. Or any other questions or comments? Okay, hearing.
I'm sorry.
Yeah.
I've got a question for
Oh, sure. Yeah. Danny? Go ahead, Paul. Yeah. No, don't be sorry, Paul.
The governor announced last week that there isn't going to be any money from the Promise Act coming to schools, although there is going to be an increase in the normal aid, and also some additional federal money is going to be allocated through the state to the local schools. I know a lot of your budget is built on a higher amount, so what does this do to you? Your budget situation?
You know, the uncertainty of the budget has made the planning process very, very difficult. You know, it's completely made this thing an extreme challenge for us. We've been trying to make all these plans, and we're uncertain as to what our budget's going to be. We did get some CARES Act dollars early. We're spending them very carefully because they go through 2022, and we don't know what this is going to look like a year from now. That's why I was so grateful when the mayor stood up and really got us the PPE out of some of his money, $3 million worth of PPE and $2 million so we could complete the K-12 with a one-to-one initiative. But you know, we've been hearing promises that they're going to increase it a certain amount. We need a pretty significant increase just to keep up with inflation, but not having a firm budget when 90% of our budget really comes from the state has been a challenge. It's comforting to hear that they're going to honor Chapter 70 and try to honor the Student Opportunity Act, but the lack of a firm number has been challenging.
Any other questions or comments? Hey, is this the governor's guy right here, too? Yes, it is. He's famous. They did a nice story on him, too. I thought that was you. You got a haircut, too. You look good. Tell Governor Baker I said hello. Okay. And we appreciate, again, all the our sign language in the... I thought it was him. If there's no questions or comments, I want to thank each and every one of you, all the media members that are here, for continuing to get that information out. Going to echo what Commissioner Helen Kalten Harris has said consistently. Thank you to the residents and the business community here in the city of Springfield. You've been great. I know it's been a challenging time, but you know we want to keep seeing that daylight at the end of the tunnel. That's extremely important. So again, I respectfully plead with you, please wear those face masks. Wash your hands. Keep that physical or social distancing. If you don't feel well, stay home. We need to continue to do this. We don't want to see any type of uptick. And I want to thank my cabinet heads down to the rank and file. As I always said, tested and true to a number of natural and man-made disasters. And I want to thank their families too, and I want to thank my family. This has been a trying time for each and every one of us. And as much as we love our families, we also love the family of the city of Springfield, and we're going to continue to work hard, as Frank Sinatra would croon or sing, night and day to defeat this COVID-19 and corona virus. So please, please do the right thing. Good health and God bless. Take care. Thank you very much.